Okay, hello to the Accutane survivors, Accutane, Isotretinoin injuries and side effects group. As I said in kind of the intro that I typed up, my name is Dr. Garrett Smith. I am a licensed naturopathic physician in the state of Arizona. My biggest thing, what will define my career, is that I have figured out how to help people out of their vitamin A toxicity problems. And for those of you in this group who have side effects, permanent, semi-permanent, where they're kind of getting better, but not all the way, this is what I help with. If you were to go and look up a lot of your Accutane, I'm just going to call it Accutane for the purposes of this. If you were to go and look up your Accutane side effects, and you were to look up vitamin A toxicity or chronic vitamin A toxicity or hypervitaminosis A, you would find most of your side effects in there. Pretty much, this sounds like snake oil to people, but pretty much every single chronic disease today can be found on the lists of vitamin A toxicities. It's kind of an epidemic problem. And when people go and take isotretinoin or Accutane, which is 13-cis, CIS, retinoic acid, it is a specific type of retinoic acid. Retinoic acid is what the scientists call the active form of vitamin A. I call it a poison. All vitamin A in my world is a poison. We don't need it. It can't be as toxic as it is, and we need it as a vitamin. It just doesn't work that way. So anyway, some of every single bit of vitamin A that you eat, whether it's carotenoids from plants, whether it's retinol or retinol esters in liver, whether it's retinol in your skin creams, whether it's supplements of carotenoids, whether it's Accutane, isotretinoin, retin-A, tretinoin, not retin-A, yeah, retin-A, tretinoin, all-trans retinoic acid is another one. Your body takes some of that vitamin A that you eat and turns it into, some of it into 13-cis retinoic acid. So every time you eat vitamin A, your body turns some of it into Accutane and retin-A. Not good. These are toxic. These are extremely toxic. And that's what this whole group is about. I mean, 8,000 people on Facebook talking about side effects of this. Now, I know some folks are in this group talking up isotretinoin as being something wonderful. There's a thing called survivor bias. And if you don't know what survivor bias is, it's an important thing to know about. Survivor bias is when people who get through something without big problems, they think that everybody else should be like them and everybody else shouldn't have had side effects and everybody else should be fine. And it's a wonderful thing. I did it, it was wonderful. I had no problems, so you should do the same thing and it'll be fine for you. And then we have an 8,000 person group here of people with permanent or semi-permanent side effects and injuries from this medication. So obviously it's a problem. We can't get around that. Well, what I wanted to go over is how this is becoming a problem. Now, there was some questions from before. There wasn't a lot of questions, but there was some. The thing I need for you guys to know is there a way out of this? Yes. You're not going to hear many other people talk about it because no one else wants to admit that it's a vitamin A toxicity problem, which it is, and they wouldn't know how to fix it other than say, well, maybe stop taking your vitamin A supplements. It's a lot more than that. So let me find this. I meant to bring up that post before I got on here, but I forgot. There it is. Great. So for those of you who are in the group, in the Facebook Live right now, feel free to, if you have questions, feel free to ask. So I want you all to know that Martin Edgar Carey told me that I was welcome to do this here because I'm one of the few people that has answers for folks like you. So this is what I wanted. I'm here to help, and a lot of free information can help. And there is stuff that I do sell. It's in the description of the video. So if you want to see that, that's there. I put all my free stuff there too. So just know I am really after helping people. So Andre, from the questions I posted yesterday for people to ask questions. So I'm going to get to those questions first. Andre's right here on the live with us right now. And he had the first question. He says, I've been terribly affected. My vitamin B12, my serum vitamin B12 was really high. No laboratory was able to measure it. A naturopathic doctor told me my liver was not working and the bilis was trapped. I believe he means bile. I also developed IBD, irritable bowel disease, microscopic colitis, and unable to absorb fat and carbs. Is there any way you can reverse these? I have food allergies. Everything is really bad. So let me set this right here so I can find links to all of this stuff. So first I want to go over the digestive stuff, okay? There's some very important things for people to realize about retinoic acid. So when you eat vitamin A, when you eat carotenoids from plants, or you take beta carotene in a supplement or in your multivitamin. I never use multivitamins because they're full of all sorts of stuff that people don't need. Beta carotene and vitamin A are big ones. So carotenoids can turn into, they can be chopped up by the body, by an enzyme, into retinoids. There's retinol, which is the alcohol form. Did you know that retinol, vitamin A, is actually in the alcohol class? There's retinaldehyde, an aldehyde, the same class as formaldehyde and acetaldehyde, the stuff that gives you hangovers. So there's retinol, retinaldehyde, retinol esters. These are what are stored in your liver and in your tissues. And then those can be turned into, down the road, after retinaldehyde, they can be turned into retinoic acids. And retinoic acids are typically the retinoid drugs. Isotretinoin, tretinoin, all these other things. Retinoic acids, you need to know, a lot of you here may be into kind of the alternative medicine realm after you find that after Accutane messes you up and conventional medicine doesn't have much for you, other than saying it's all in your head or we just don't know what to do with you. So when you get into kind of the more alternative forms of medicine, you start, you hear about vaccines and you hear about chemotherapy and these things, and maybe these things aren't so great for you either. Here's what you need to know about retinoic acid first. Retinoic acid is used as a chemical peel for the skin. Dermatologists have said it is used to induce, these are their quotes, controlled wounds of the face. It basically dissolves the face skin so that you can have new tissue come up. That is what retinoic acid does when it is applied to your face. Okay? Keep that in your head, right? What do you think retinoic acid that you eat, that vitamin A that you eat, that is eventually turned into retinoic acid, that is part of how the body has to detox it. What do you think happens to your gut lining when retinoic acid, a chemical peel, is applied to it? Do you think it could start to irritate or inflame? So we have inflammatory bowel disease or irritable bowel, irritated, inflamed, chemical peel. Think if you applied a chemical peel via food to your guts every day. Do you think it'd be irritated? Probably, right? So that's one use of retinoic acid. Another use of retinoic acid is as a chemotherapy. Chemotherapy is using a known poison to hopefully kill the cancer before it kills the person. And there's really no argument there. I mean, the track record of chemotherapy is, yeah, you're lucky if you live through it, right? They're saying that, the assumption is, oh, well, the cancer is going to kill you anyway, so let's try chemotherapy, and maybe it'll kill you, but maybe it'll kill the cancer first. Vitamin A, retinoic acid, is used as chemotherapy. You want to know, if you think of birds of a feather flock together, a common combination of chemotherapy is to combine retinoic acid with arsenic. Go look it up, arsenic trioxide and retinoic acid. And they combine them, and they are really hoping that you don't die first, that the cancer gets killed first. So we have chemotherapy, right? Vaccines. It's also, vitamin A has been studied for use in vaccines as an adjuvant, which means something that hyperstimulates your immune system so that it reacts more strongly to the vaccine. Now, maybe we have problems today with hyperimmune system problems like autoimmunity, where the body's so ramped up that it attacks itself. Now, there's different explanations of autoimmunity. I understand this. I'm talking about the common one here. Now, let me find my post. Do you know that Accutane has been linked to practically almost every body system has been shown to, in at least one person, to have autoimmunity induced in that body system by Accutane? Okay. Let me put this in here. So I'm putting it in the comments here. Okay, let me just run through some of these. So let me find the retinoic acid stuff in here. Oh, yeah, Johns Hopkins said that vaccines could be used to induce autoimmunity. Oh, chemotherapy. So here's the other thing. So chemotherapy, I have multiple papers in this article that I linked there. Chemotherapy has been shown to induce autoimmunity. I'm going to tell you here that all autoimmunity is vitamin A toxicity at the foundation with other problems layered on top of it. So we now know we have the chemical peel effect, where it could be basically dissolving your gut skin inside of you, the same stuff it does to people's faces. And then we have it's used in chemotherapy, and I have multiple papers here talking about autoimmunity being induced by chemotherapy. So those are connected. And let me get to the papers on where are we? Boy, this is a long paper I wrote. Oh, for those of you who are interested in hair loss, it was shown that retinol binding protein, which is a binding protein that goes along with vitamin A, was increased in autoimmune hair loss. So autoimmune hair loss, alopecia areata, was shown to have higher levels of the protein that the body makes to bind to vitamin A to protect you against it. Then we have 8 weeks of all trans retinoic acid treatment resulted in significantly higher autoimmune scores in rats. Where is, I had, this is the wrong link. Not the one I wanted. I will find it. Let me go back to that search. I will, there it is. Yes, okay, so I found the right one. 13-cis retinoic acid, the stuff that's in Accutane. I've shown here, there's a paper. It's normally in your blood if you are eating vitamin A. Okay, here's the title of the next study. We have Hashimoto's. Presumed isotretinoin-induced concomitant autoimmune thyroid disease and ocular myasthenia gravis. A case report. So, 19-year-old male got autoimmune thyroid disease from taking isotretinoin. Next, we have Graves' disease, which is, so Hashimoto's is low thyroid, Graves' is high thyroid, excess thyroid, hyperthyroid. So title of this paper, Isotretinoin as a possible environmental trigger to autoimmunity in genetically susceptible patients. Next, we have a paper showing rheumatoid arthritis caused by vitamin A, retinoids. Next paper, isotretinoin-induced arthritis, mimicking both rheumatoid arthritis and axial spondyloarthritis. Next paper, isotretinoin-induced inflammatory bowel disease. There you go, Andre. Next one, possible association between isotretinoin and inflammatory bowel disease. These are just the titles. Next title, isotretinoin and intestinal damage. Isotretinoin use and the risk of inflammatory bowel disease, a case control study. Next one, autoimmune diabetes. Association between oral isotretinoin therapy and unmasked latent immune-mediated diabetes. They're saying autoimmune diabetes. Next paper, the liver, autoimmune hepatitis, liver inflammation induced by isotretinoin. Autoimmune epilepsy. Here we go. Here's the paper. Neuromuscular adverse effects associated with systemic retinoid dermatotherapy. That would be retin-A. Monitoring and treatment algorithm for clinicians. They talk about epileptic seizures being induced by retinoic acid. That's in the quote here. Here's another title, isotretinoin, possible cause of acute seizure and confusion. Next one, isotretinoin, a possible cause of epileptic seizures. Guillain-Barré, which is a syndrome that people get typically after vaccines. Guillain-Barré syndrome seen in users of isotretinoin. It's a really bad neurological condition. You don't want that. Next one, vitiligo, appearing after oral isotretinoin therapy for acne. These are all real studies, okay? I'm not making any of these up. I have links to PubMed for all these. Next, autoimmune. This is a type of autoimmune vasculitis or inflammation of the blood vessels. Henoch-Schönlein purpura during isotretinoin therapy. So we got a blood autoimmune condition. Autoimmune thyroiditis and isotretinoin, real association or coincidence? Well, we got enough papers here that it's not a coincidence. And then I have a paper here on multiple autoimmune syndromes. So it's well known that once you have one autoimmune syndrome, you tend to get more. If you don't deal with this, and I'm not a fear monger. If you don't deal with this vitamin A toxicity problem that you have now, if you're here in this group and you're taking the time to watch this video, you're probably dealing with some fallout from the medication. Now, some of you might be watching and kind of thinking this is BS, you know, oh, I took Accutane, my skin is great, my acne's gone, but now I have Hashimoto's, autoimmune thyroid, or now I have rheumatoid arthritis. And what happens, I've seen this with vitamin A where people apply like high carotenoid things to their scalp in the hopes of regrowing their hair, or where they put on retinol skin cream on their face and they love what it does for their face. And then along the way, their hair's doing better, their skin's doing better, and they develop an autoimmune disease. So you can develop a problem elsewhere from applying it topically. The problem doesn't have to show up on your face or on your scalp. It can show up internally. And this is the part that some people have trouble realizing. Vitamin A toxicity can attack every single part of your body. Let me put that link in here. Sorry, I didn't do the link yet. We'll plug that in. This article has all the links that I just mentioned. I hope you caught that. You can straight up give yourself an autoimmune condition with this medication, with isotretinoin. Every system of the body I mentioned pretty much. I don't think I mentioned the lungs, but everything else. So, Andres, we talked about the irritable bowel condition in there. The liver, gallbladder. For any of you in this group who have gallbladder problems, let me find that link. I've written articles on all of these things. So for those of you who want to go look at the links to my, what I call my public blog forum, I call it my blog forum because it's a forum, but I kind of blog there. So that's what I call it. Gallbladder, bile. The body will tend to stop making as much bile when there's a vitamin A problem because it doesn't want to absorb more vitamin A from your diet. Research shows that when people eat vitamin A in foods, they make less bile. Your body is saying it doesn't want it. So that's not a great endorsement. So we covered, oh, B12. Oh, let me find B12. Vitamin A, retinoic acid, 13-cis-retinoic acid, isotretinoin, vitamin A. It's all in the same retinol, retinol palmitate, carotenoids, beta-carotene, astaxanthin, lutein, zeaxanthin, all of them. Okay. They're all bad. They all go to the same place. Vitamin A depletes B12, vitamin B12, and folate. So Andre, you're saying what's going on in your situation, Andre, is you're losing B12. See, think about it. To get B12 into your system, it has to be eaten, it has to go into your blood, and it has to go to your tissues. Well, if you were losing B12, or you couldn't get it into your cells, it's going to show up in your blood too, because you get rid of things through your blood. Also, this is the thing that people don't always realize. They think it must be coming in too fast. And as an example, if we were to say, Andre, are you taking B12? And you say, when you did that blood test, and you say, no. When they go, where's all this B12 coming from? It must be coming from your tissues. It's leaving. It's not coming in, it's leaving. You're losing it. It's a losing pattern. So let me find the research that I've accumulated on B12 and folate being depleted by vitamin A. I don't know why. The little search engine on my site is a little... Let me look up folate. That'll get me there. There it is. So to deplete something like B12, something would have to come in and trigger the loss of it. I think there's 4 different papers with case studies of B12 and folate being depleted. Tons of people nowadays in the alternative community are into, the MTHFR genetics, and they talk about how they need more B12 and more folate. It's not that, they're just vitamin A toxic. So just so you understand what I'm saying, nearly all of our chronic diseases today are directly or indirectly related to vitamin A toxicity. How we get there, I'll explain that a bit later, but vitamin A toxicity, aldehyde toxicity, which is another part of it, and what glyphosate does. If you've heard of glyphosate Roundup, there's the big lawsuits now about leukemia and lymphoma caused by glyphosate. What does glyphosate do? One of the big things it does is it blocks your liver's ability to break down vitamin A, to break down the retinoic acid specifically. So you build up, if you're eating glyphosate, and even if you're eating very little vitamin A, the glyphosate is going to block your liver's breakdown of it. You're going to build up vitamin A. How long does it take a dripping bath to fill up? Well, a lot longer, but it still fills up eventually. So if you plug the drain, like if glyphosate blocks the liver's part of getting rid of vitamin A, then you can build it up. Let's say you're eating lots of glyphosate, a lot of non-organic foods back when you took Accutane. You block your body's ability to get rid of retinoic acid, and you take a drug that is straight retinoic acid. Does that sound like a recipe for disaster? Yes. Now, when you take that retinoic acid, I have the research, it slows down your aldehyde dehydrogenase, a very specific enzyme in your detox pathway. It slows it down, and I don't know that it ever recovers. And this is why people get sick from this medication and they never get better. Now, I want all you guys to know who have made it this far, you do not have to understand everything I'm saying. It's not required. I'm here to educate. That's what I do. My old website was doctorasteacher.com because I teach people why they need to do this stuff, what to do and why they want to do it. You don't have to understand all of it yet. It soaks in over time. You may never understand all of it. All you really need to know is what to do. One of the first things is reducing vitamin A in your diet. Getting rid of any supplements that contain carotenoids, keratin, vitamin A. Getting rid of vitamin A from foods as much as possible. You can't eliminate it entirely, so don't get that idea in your head. In my detox program, I have food lists. I talk about other foods that affect things. I go over all that stuff. You can try to do it on your own. You may or may not make some pretty significant mistakes on your own that I've figured out along the way. But anyway, let me get back to Andre's question. We talked about the irritable bowel, unable to absorb. That's kind of the leaky gut thing. We talked about that. That's the retinoic acid. Is there any way you can reverse these? Yes. Food allergies. I would bet, here's a funny thing. For those of you who have ever done food allergy testing in this group, like the blood testing, if you were to go and look at your list of foods that you're allergic to, now I'm not talking about anaphylactic allergies. I'm not talking about EpiPen stuff here. I'm talking about the blood test, the IgG, IgM, I think is the other one that they're doing now. If you go and look at that list, you'll probably see that those foods are a lot of high vitamin A foods. It won't be a coincidence. There are no coincidences. So on to the next question. Jessica, is elevated cortisol a noted long-term side effect that you have heard of? So here's, and then Rachel seconded this question as well, as could it cause all the symptoms of high cortisol permanently, but not necessarily show high cortisol in any lab tests, serum, saliva, or urine? So this is the strangest thing about vitamin A toxicity and the side effects for this medication, as I've seen with people talking about with side effects from this drug. Some people say they start taking Accutane and they get super oily skin. And then after a while, it gets super dry. Do you see how those are the complete opposites of each other, but the same medication did totally opposite things in the same person over time? Vitamin A can cause totally opposite symptoms in different people, and even over time. One example, common thing in the literature about vitamin A toxicity is anemia. They say it causes anemia. But there's also research out there saying that too much vitamin A will cause iron overload. Which one is it? Well, it's both. This is the thing that's very, very confusing for people who can't open their mind to the same poison causing different symptoms in different people. So what I do know in terms of, there are studies, there are papers out there with retinoic acid where they use retinoic acid to suppress Cushing's. Let's see if I can find it. Oh, can I find the Cushing's paper right now? Well, I may not find it right now. I don't want to spend too much time looking for it. Cushing's disease is, Addison's is hypoadrenal, not enough cortisol, and Cushing's disease is high cortisol. Retinoic acid has been used as a treatment for Cushing's. So Cushing's is an autoimmune adrenal condition, and they've used vitamin A, retinoic acid, to hammer it down, to hammer down the cortisol. So now I can tell you, when you're asking the question of could it give all the symptoms of high cortisol without cortisol actually registering, vitamin A toxicity symptoms are totally associated with anxiety. Absolutely. Part of that's probably because it blocks potassium channels, and when you can't get potassium through, anxiety and depression and low energy happen. So do I have specific research on, I have the specific research on the Cushing's, but like I told you, you can have paradoxical effects. You can kind of have both. You could have symptoms of high cortisol and then later symptoms of low cortisol. It's kind of like Graves' disease and Hashimoto's disease in terms of thyroid diseases. If somebody gets Graves, which is hyperthyroid, if it goes on long enough, the body, the autoimmunity destroys enough of the thyroid that you then go hypothyroid, low thyroid, and then you've gone through both phases. You've gone through the hyper and the hypo. So I'm sure the same thing can happen with Cushing's, going hyper-adrenal to hypo-adrenal. Do we help mental status and feelings of anxiety and racing heart and other signs that you're talking about probably with high cortisol? Do we help those? Yes. A lot of that is, I do have the research on vitamin A blocking potassium channels. Let me see if I can find that one. There it is. Vitamin A blocking potassium channels. So most common symptoms I see, again, for those of you who are joining late, if you want to ask questions, shoot them over in the comments. I can talk. I don't need questions, but I can talk if you don't want to ask questions. So vitamin A in white blood cells was shown to block potassium channels. Common low potassium symptoms, the mild ones that people notice: trouble falling asleep initially at night, fast heart rate, irregular heart rate, especially when you lay down at night. This is the biggest one: cramps in your feet or calves at night. Dead giveaway. Anxiety, depression, fatigue will often be improved if people get some more potassium. High blood pressure is another common one that's kind of a potassium deficiency symptom. So the thing to know about this is people are getting potassium deficiency symptoms because the vitamin A, the retinoids, the retinoic acids are blocking the potassium channels. It'd be kind of like if you wanted to have a party at your house and somebody locks the door. And so the potassium is trying to get into the party to have a good time, and the vitamin A keeps locking the door and locking the potassium out. So there's potassium out there, kind of like Andre, you were talking about B12 in that. The B12 is wandering around in your blood, but it's not getting into the cells, and it's probably on its way out. And so you may have B12 deficiency symptoms while the B12 in your blood is super high. Same thing with vitamin A. Your blood potassium may look fine, but if it's not getting into the cells, if it can't get into the party to have a good time, then you don't get to have a good time. This is the complicated stuff. This is why, again, I don't need you to understand everything. It's like anything. Usually you start doing it, you have a kind of a coach say, do this, do this, do this, and you do those things, and along the way you learn the whys. Very common learning approach. Okay. Ash, you've developed SIBO and severe GERD as a result. How would I treat that? It always, well, we can go through the three kind of approaches that I do. Okay. And I mentioned these in the comments on this video. The first thing, what I built my reputation on, I call nutritional restoration, which is where I do blood tests for vitamin A, copper and zinc, and iron. If you live outside of the US, you got to get those blood tests on your own. I can't help you with that if you're outside of the US. I do deal with international clients all the time, but I can't order blood tests outside of the country. So people got to get those on their own. And then we do deal with hair tests. I do hair mineral analysis where we look at 36 different minerals. And so between the blood tests and the hair test, I have a pretty good idea of the important minerals and nutrients that we need to work on. We correct nutrient deficiencies. We correct excesses, like some people who have vitamin A toxicity have way too much calcium in their system, slowing everything down. And then imbalances between minerals. So we fix the excesses, the deficiencies, the imbalances. That's the nutritional restoration part of it. For those who are in this group with Accutane side effects, where it's very, if you're like, it's very specific. My life was great until I took Accutane, and then everything fell apart. That becomes something that I do something called homeopathic detox therapy, which is very targeted homeopathic remedies for specific medications. And when I do the homeopathic detox therapy, we always pick the first, we have the first round, we do the medication, and I always do a remedy that's for the gut at the same time. That's how I do it. So we've got this kind of general gut remedy, and we've got the medication remedy, which for many people in this group would just straight be Accutane. If you were saying, my life was great until I took Accutane, and then the words are never been well since. I've never been well since. Homeopathic detox therapy is something that we can do. Then homeopathic detox therapy, just so you understand, it doesn't make you detox faster. Think of it as if you had a shower drain that had a bunch of hair stuck in it and the water's running through it slowly, think of that's what the Accutane did to your system. The Accutane is the hair that screwed up your detox system. The homeopathic detox therapy just pulls out the hair so that the water can drain like it's supposed to. That's what homeopathic detox therapy does. Then the simplest thing, the do-it-yourself thing that a lot of people do, that I've kind of become known for, is my vitamin A detox program, which is I have a new Mighty Network, my own little kind of social network, where I present the course. You can join the network for free. If you want to get the vitamin A detox program, that's paid, and you can go check that out if you want. Avoiding vitamin A and avoiding certain things that aggravate vitamin A toxicity or slow down the detox pathways. Like, as an example, alcohol uses the same exact detox pathway that vitamin A does. Ethanol is alcohol. The alcohol we drink is called ethanol. Retinol is an alcohol. You hear how they both end in "ol." So retinol turns into retinaldehyde. Alcohol, ethanol, turns into acetaldehyde. And then depending on certain things you're eating, you might be consuming methanol, which is also known as wood alcohol, the stuff that used to make guys go blind from homemade liquor, moonshine. Methanol is wood alcohol that turns into formaldehyde. And so if you have a lot of these other things coming in, if you drink regularly, your vitamin A detox pathway is used up. It's being used by the alcohol. The body will do the alcohol first instead of the vitamin A. So these are things that are in the detox program that I talk about. Drinking too much coffee slows down the detox system. Who knew until relatively recently? This is why I'm always doing research on this stuff. People are feeling a lot better on the detox program getting rid of coffee. It speeds up your detox, getting rid of coffee. People hate to hear it. It's true. So yeah, it would kind of be, we get the nutrients back in. Homeopathic detox therapy can unlock those broken detox pathways. There's the do-it-yourself vitamin A detox program, which you can do with or without, my help. Anybody who buys a nutritional restoration package with me, so doing the hair testing and the blood testing, they get the vitamin A detox program course as part of working with me. So that's included in the packages. And then those are the main things. Let me see if I wrote anything else down. Yeah, and then there's, we can use supplements as part of the program. So drgarrettsmith.com is where some of the supplements that I use are sold. But those are a lot of it can be done. I mean, some people have done pretty well just on their own. They look up vitamin A foods and they don't eat them. It's not as easy as that. And one of the goals, so you guys in this group are obviously already suffering. That's why you're here. The vitamin A detox program is not some like super easy program. I mean, in terms of there's going to be detox. The Accutane you put in was a poison on the way in, and it's a poison on the way out. So there are detox symptoms. People who say it's all just going to be, if you guys are in here because of a medication, and let's say you go and try to do the vitamin A detox on your own and you just avoid vitamin A foods, and your detox pathway is all, instead of being open like this, because of the Accutane you took, your drain is only this big instead of this big, there's times where you're not going to feel good. That's why I do a lot of the stuff I've been working on, that the whole intention behind it is to make the detox process easier and less suffering, because it's not an easy path. I mean, people do get their lives back. It takes a while. It can take a year or even 2 of working on this. This is a huge part of why people are so sick these days. And that's the truth. So I'm having trouble getting the questions back at the bottom. I don't know why, but those aren't showing up, so I'm gonna have to get to them another way. Angela, I'm going back to the original questions. I will get to their questions below. I'll just have to get to them. I'll have to find them on my phone. So Angela asks, I think a general talk on everything would be great. Well, I'm trying to do that. Here we go. Thanks for doing this. I think the most common issues are gut not working. We've been talking about that. We got to get the vitamin A. What's happening with the gut is, if we can't do that last segment of getting rid of the retinoic acid, you have, it's a long explanation. I don't want to get into it here, but we have what I call a detox loop, which is where the body tries to get rid of vitamin A into the gut. But if you're not pooping well enough, often enough, like once a day pooping is the absolute minimum. If you're missing days of pooping, you're not detoxing well, and you are recycling your toxins. So if it's not gotten rid of, you can reabsorb it, and then it has to go through your liver again. So it goes into the blood, which is where you feel bad. Then it has to go through your liver puts it into the bile goes into the guts. If you don't poop it out in time, you reabsorb it, same dance. I call it a detox loop. And then now, every time it goes back down into your guts, it's going to irritate your guts. So that's a big gut thing. Brain fog and memory issues. Yeah, that's a lot of that is, I mean, here, let me do my whole paper, the article I wrote. One of the biggest articles I wrote was on Alzheimer's. There it is. Oh, now it's gonna, wait. It's still not showing me the comments. Anyway, so I posted the one on Alzheimer's. Vitamin A damages your brain. Pretty straightforward. There's a whole paper called the neurotoxicity of vitamin A. It's in that paper. It's disgusting. You start to wonder how this stuff looks like a chemical weapon. And people who are in this group, you might agree, like, what did I take that just ruined me? That the doctors and everybody else, some of the other people in this group are like, no, it's just fine. It's totally safe. No, it's chemotherapy. It's added to it's used in vaccines to stimulate immune reactions. It's used to burn people's face off chemically. Like, it's not safe. It's not. Some of you might get away with using it. You might end up with a health problem 5 years down the line, 10 years down the line, and you wonder, how did this come up? I'm going to tell you, look back here. Come back here when you're not sure how that health problem started. So the depression, yes, I have a whole paper on, if you want to talk about depression and mental stuff, here's a paper for you. 3 independent lines of evidence suggest retinoids as causal to schizophrenia. That's pretty far down the mental health state. So low mood is like Low mood sucks. It's not schizophrenia, but if it can cause schizophrenia, sure as heck can cause depression, right? I posted the post-retinoid sexual dysfunction, which I think was the next thing you mentioned. Not feeling like, oh, dissociation. Oh, wait. Oh my gosh, I found that before. Well, oh, I'm sorry, schizophrenia. Dissociation is part of schizophrenia. I just posted the link as 3 separate lines of evidence showing retinoids, vitamin A, are causal to schizophrenia. So that dissociation feeling is vitamin A toxicity. Okay? They're the same thing. Dissociation is part of schizophrenia. Not feeling like you're in your body or not feeling like yourself or being like third person kind of thing. And then sexual dysfunction issues. Post-retinoid sexual dysfunction. You guys are not alone in this. There is a giant petition. Citizens petition. The undersigned submits this petition to request the Commissioner of Food and Drugs to immediately require the addition of warnings, precautions, highlights of prescribing information, and a boxed warning to the product label for all isotretinoin products, including branded and generic formulations, for the sexual side effects of Accutane. Now, let me see if I can find the paper about where so when scientists didn't take out the retinoic acid, the baby mice or rats, their testicles didn't develop properly. Wait, I think I did that one. Maybe that one will be twice. Sorry if it's twice. I'll go back and delete it. So they had to remove vitamin A from the experiment with the mice to get the testicles to develop properly. Young men in, I think it was Spain, the more organ meats they ate, like liver, that people are talking about being healthy, the more organ meats they ate, the less sperm they made and the less well their sperm moved around. I do have a couple of, this will make, let me see if I can find any. I do have one where it's like, oh, vitamin A toxicity causing infertility in men. I don't have as much on women, but you, ladies, you need to understand, if it's damaging men's testicles, it's damaging the ovaries too. If it's damaging the prostate, it's damaging the uterus. Same types of tissue, same developmental. It's one poison. If it damages the one tissue in men, it's going to damage the same tissue in women. So how do we fix that? Zinc is huge, but people, if you hear me say zinc and you go, oh, I'm going to go take a bunch of zinc supplements, you can cause problems with too much zinc. That's why one of my sayings is we test, we don't guess, and then we address. I have a lot of experience with dosing zinc. We find out if you need it first, and then we give it. Okay. What else do we have? How does it destroy the gut from Jade? I already answered that one. So let me go in here and find. If you want to talk about depression and mental stuff, I don't want to hear myself talking on the video. And oh my gosh, I can't find the questions. I don't know why this is not letting me see the questions. Let me see if I can't find it in the group. So I can't see the questions here, so I don't want to miss out on anybody. But we talked about how I would fix it. So that's important. Let me get in here. There we go. We're going to find it now. Here we are. Got it. Yeah, okay, so you guys, it's not letting me go back in the questions so much. So if you had a question from earlier, I see Veronica's question, does Accutane have any effects on SSRI medications while taking Accutane? So if you, sorry, Veronica, I'm gonna get to your question. If you guys posted questions earlier, I can't get back to them the way this Facebook Live is working. So if you wanna just repost them, just copy and paste them again if I didn't answer them. So Veronica, does Accutane have any effects on SSRI medications while taking Accutane? Okay, this is super important. Let me find, I have a post on this. Imagine that. Here we go. I'm going to post this here. What what SSRIs do. Listen to the title of this study. Direct inhibition of retinoic acid catabolism by fluoxetine, which is Prozac. Direct inhibition, it slows down or stops of retinoic acid catabolism, of the detox of retinoic acid, Accutane, by fluoxetine, Prozac. Prozac directly slows or stops the breakdown of retinoic acid. If your toilet doesn't flush and it backs up, if your toilet's not getting rid of the garbage, you get lots of buildup of bad stuff in your bathroom. Prozac stops. So if you were taking, okay, so if somebody was taking or had taken Prozac before they took Accutane, because of the way Prozac is going to affect the detox systems, this effect, usually these medication effects, they stick around. They don't leave after you're done with the medication. This is what you guys are here for, right? You're like, I took Accutane, I stopped it 2 months ago, a year ago, 20 years ago, I still have problems. That's what you're here for, right? These medications affect things. They like flip switches that don't get flipped back automatically. Prozac, if you had taken it, or another SSRI, would slow down your detox of vitamin A, retinoic acid. So then, if you took Accutane after that, you would probably be much more likely to get toxic from the Accutane. Your reaction to Accutane would likely be much worse. If you were on Prozac while you took Accutane, that was probably just straight disaster. And you would know that better than I would. If somebody took Accutane and then took SSRIs later and they were already running a toxicity, I could bet that the SSRIs would worsen their symptoms. So that is, these medications, people don't realize when you go and you take pharmaceutical medications, they often flip switches, change things in your body that don't just get flipped back. The things that the medications can affect that affect vitamin A toxicity, retinoid toxicity, we have things that affect the alcohol dehydrogenase system, things that affect the aldehyde dehydrogenase system. These are the same things that detox you from alcohol. Let's say before you took Accutane, you tolerated alcohol well, didn't get too hungover, didn't get drunk too quick, and then after Accutane, all of a sudden you can't handle your liquor and you get horribly hungover. I know why that is. It's because of what the Accutane did to your aldehyde dehydrogenase system. And then there's the cytochrome P450 system, which is another system in the liver. That's what actually gets rid of the retinoic acid. So I've looked into this a bit. I have an idea of these things. So, okay, Leah, your 15-year-old daughter was started on Accutane 4 weeks ago. She has tried many other treatments, both prescribed and homeopathic, and tried diet. Her skin was making her so depressed and self-conscious. She was adamant that she wanted to take it. I'm so anxious about the journey and future effects. Is there any research that suggests a high percentage of long-term effects following Accutane? I'll get to that in a second. Also, are there any supplements she could take during her 6 months on it that may help to reduce any immediate or long-term side effects, please? Okay. About side effects, percentages. I'm not too big on percentages per se, because for those who are here in this group who got side effects from Accutane, the percentage of side effects in each of those people was 100%. You know, it doesn't matter if people say, well, what's the percentage of side effects from this drug? Is it 5%? And let's say the doctor or the pharmacist says, yeah, it's 5% for irritable bowel. And then you go home and you're one of the 5%. Did the 5% really matter to you, or does it just matter that you now have this problem? It's 100% your problem now, right? The acne, one of the things that's strange about acne is that Accutane, you know how I told you that Accutane can cause 2 different types of effects? So Accutane can be like destroying your insides while it makes your skin normal. So, you know, it's kind of like robbing Peter to pay Paul kind of thing. I would not, I mean, okay, the only thing I can say about, okay. And I know you're a mom and you're concerned about your daughter. She is only 14. The problem here is that the effect of Accutane on the skin from the inside out is due to its nature. Its nature, in my opinion, is that of a poison. So if I were to tell you things to do to protect her or to reduce the side effects, I'd basically be reducing the effect of the medication. You understand, right? Like they used to give mercury for syphilis. I was telling you they give arsenic plus vitamin A for chemotherapy. You can use poisons to do things. You know, we give kids amphetamines for their supposedly ADHD. Amphetamines are poison. We're giving our children poison to get them to sit still. We can use poisons. Poisons have uses. They have biological effects. Whether people want to live with the side effects of it after that, well, nobody ever thinks about the side effects until they take it. You know, I have a tough time. I mean, I don't know what to tell you. If it was my child, I would not let them take it. If you wanted to work on something other than Accutane, then, I mean, not to toot my own horn here, but it would be working with me. So that's, I do believe acne is a vitamin A problem. And taking Accutane can seem to make acne go away for a while or even permanently, but it's causing other issues along the way. And like I said, for the people who said, I took it, it was great, it worked for me, it didn't cause me any problems, you are the 1% of people who did not have side effects from it. So I don't know what to say to you. Lucky you. I hope you never develop any of the problems that I treat every day from this poison. So, Leah, I don't, or 15-year-old, I don't know. I have an 11-year-old daughter and an 8-year-old son, and I'm already teaching them about how toxic vitamin A is. I've helped my boy do amazing things with, my boy had sensory processing disorder. He was probably a teeny bit on the spectrum. We've got him, he's in advanced classes now. He was on a climbing team. He's playing soccer. He's doing great stuff. And I started detoxing him of vitamin A, not putting it not in his diet. So with the skin stuff, I wouldn't let my daughter take it. I don't know what else to tell you. It's a choice between, it's like saying, if I'm going to shoot myself with this gun, what can I do to minimize the damage? And you're like, you're going to shoot yourself with a gun. There's going to be a lot of damage. If you wear a bulletproof vest, if the goal was to shoot yourself with a gun, you're going to stop the bullet. You're not going to get the effect. So I don't want to harp on this too much. What you could do is minimize the rest of the vitamin A in her diet, so you're not overloading the system from every possible angle. Other than that, I don't really have a lot of advice for that. So Dory says, yeah, I can't drink now, get smashed on very little and throw up. It's a no-go area for you now. So see, this is what I'm talking about. What retinoic acid does, what Accutane does, is it shuts down your detox pathway for vitamin A. It's very strange. So taking it shuts down your detox pathway, so you build up more. It's a negative feedback loop. Leah, she's 16 next week, so technically she is Fraser competent, therefore my input is very limited, and her being a teenager suffering with awful skin only sees the end result of clear skin. If the choice was mine, I would say absolutely no way of taking it. Thank you for your advice. How do I go about working with you to help the Accutane and therefore persuading her to ditch the Accutane? You know what we can do for somebody who is taking a medication? Actually, homeopathic detox therapy can be done as soon as a medication is stopped. So I would be doing things, if you were really going to go whole hog to prevent these problems, and she's going to do it anyway, I would be working on the nutrients, like especially, zinc would be super important. There's some other nutrients, but getting zinc right. Let me put it to you this way. For those of you out there who just think you're going to just go out and buy some zinc and start dosing it just willy-nilly, you're hearing me talk about how much work and effort and thought I've put into all of these things. The dosing of zinc is the part of all of this that I spend the most time on. And when I consult with people, getting their zinc dose right, not more, not just more and more, but getting their zinc dose right is the most important thing I do in terms of the nutrients. So there would be getting the nutrients right. There would be, we wouldn't do homeopathic detox therapy before it or during it, but we would do it as soon as that medication is over or she quits. Whether she quits or she finishes her course, as soon as that's over, we would start the homeopathic detox. For the Accutane, we would do an Accutane remedy. We're doing the remedy for Accutane as soon as the Accutane remedy is done. And then during that time, I would have you or her trying to make sure that she's eating as little vitamin A as possible, not doing any supplements of vitamin A, possibly doing some other items that help the detox systems. Black cumin seeds, black cumin seed oil is a super helpful one. C60 could be another super helpful one. That's at the drgarrettsmith.com website. I'm not going to go over dosing any of this stuff here because I can't give dosing information to just random people on Facebook. Sorry, I have a license to protect. So, one of the things you might do, Leah, is have her come. I know she's 16. 16, like kids are, they think they know a lot more than they do. I thought I knew a lot at 16. But what you could have her do is come here and read the side effects. Read people's posts day after day. and see if that can get through to her. I mean, I know she's a girl, she's 16, her skin's very important, and I understand all that. I'm going to deal with that with my daughter very soon. I'm hoping that I can avoid the skin issues by having her diet knowingly low in vitamin A from the very beginning. I do believe that vitamin A is the source of acne problems, and then somehow people are using Accutane to increase the skin's turnover so that it kind of gets rid of the acne by turning over the skin so fast. But I think what the body was trying to do was to push toxins out through the skin. Acne is toxins out through the skin, in my opinion. And it's because the liver, so think about this. Uday, I'll get to your question in just a second. Your body has 3 major organs of detox. 3. You have your liver to the bile, to the poop. You have the kidneys. Kidneys create urine, you pee it out. Those are the ways your body is truly designed to get rid of toxic stuff. You're going to poop and pee every day. It's normal. We're getting rid of liquids, we're getting rid of solids, we're getting rid of toxic stuff that way. Now, if your liver and your kidneys are not running fast enough to get rid of the toxins, if their workload is so much that it's backing up, your body says, we got to get rid of these toxins. How can we get rid of them? We push them out through the skin. The problem with pushing out toxins through the skin is it's toxins in your skin and on your skin. So you start pushing out the toxins, and it irritates the skin that it's touching, right? So I believe acne is one of the manifestations, any skin stuff, generally, psoriasis, eczema, acne, it's all toxins pushing out through the skin. So one of the things we really need to do is get the liver running faster and make sure that the kidneys are doing their job and not being overloaded. And it's not just drink more water. God. If detox was that easy, oh my God, we'd all just drink water and be fine. It's not that easy. People who say detox is just drink more water. No. Take laxatives, take herbal laxatives and just drink more water and just pee out your butt and pee out your, Detox is not that easy. I wish it were that easy. So, okay, Uday, can detox cure sexual side effects? Yes. Takes a while, but yes. And I have some very specific things to help with that. Leah, I caught your thing. You meant help with skin. Yes. Angela. Okay. Let me get that whole post. You just jumped on here now, so you might have already spoken about this. I will rewatch once it's done, as I missed most, but wondering, have you spoken about copper in relation to acne and also Accutane? Does copper imbalance potentially cause acne, and then Accutane messes up copper levels more? Okay. So zinc, copper, if we're going to talk about copper, we got to talk about zinc. And if we're going to talk about copper and zinc, we're going to link it to vitamin A. Copper toxicity problems. I mean, there's, we have copper water pipes. There's copper in your water if you got copper water pipes. There's people trying to do, super high, vegan diets, which are, when you eat a vegan diet, generally you're going to be deficient in zinc and excess in copper. And the opposite of that is the people doing like the all meat, all beef, water, salt, carnivore diet are going to be too high in zinc and low in copper. You got extremes. If you take an extreme diet, you're going to get extreme results, for better or worse. Now, I will tell you that some people have had good results on the carnivore diet, the version of it that is beef and water and salt. I do think there's problems with it long term, but people have done a vitamin A detox with beef and water and salt. So for those of you who are like, you need things to be super simple and you're like really focused, that beef, water, and salt has worked for some people, but I don't think it's viable long term. I do think we are designed to have plant foods. That's why we have molars, these flat teeth for chewing and grinding plant food. I do not believe we are supposed to be all vegan. I do not believe we are supposed to be all meat eaters. We would have claws and more sharp teeth if we were supposed to eat all meat? We're mixed. We have both. We should eat both. Seems pretty simple to me. So, copper. Let me just talk about how I fix copper. When I find some, I believe that copper problems come about two ways. Vitamin A toxicity affects copper levels and they tend to go up. But in rare people, you can see copper levels go down. I call them low copper people, and they're not common. It's mainly one little area of Europe where these people come from genetically, and all I need to do with them is just not screw up their copper, not make it go lower. The people who have high copper, how do we fix it? We have them do the vitamin A detox, and then we give them the right amount of zinc. Is copper involved in, I mean, does Accutane, I have not ferreted out all the mechanisms of how copper and vitamin A interact because there's not that much research. I will tell you one of the things that is out there, there's somebody out there who loves to talk about root causes and ceruloplasmin and copper and all of this. So for those of you who know who I'm talking about, you'll know. You either know or you don't. So ceruloplasmin is the binding protein for copper. I have a paper showing that in chickens, when they gave them vitamin A toxicity, their ceruloplasmin went down. If you do not have enough ceruloplasmin to copper, you end up having too much free copper, unbound copper, which causes all sorts of problems, especially mental. So how then do we fix low ceruloplasmin relative to your copper levels? We detox the vitamin A, and we get you enough zinc because zinc is the natural antagonist to copper. And so you can use zinc. First of all, if somebody's vitamin A toxic, they likely have a zinc deficiency. If somebody's copper toxic, by the blood, not by hair test for copper and zinc is not totally useless, but mostly useless. Blood tests for copper and zinc only, plus the hair test if you got it. So people who are copper toxic usually have a zinc deficiency. People who are vitamin A toxic usually have a zinc deficiency. How do we fix it? We give them the right amount of zinc. We have them avoid vitamin A. Sometimes I'm more about the solution than I'm about all the mechanisms. And that's kind of how I do it. But yeah, ceruloplasmin is affected negatively by vitamin A. So, how to get the detox pathways to open? Okay, well that kind of gets into we do the opposite of what everybody's doing. As an example, sunlight. I found research. Going to bed earlier helps the detox pathways. These are just examples of things that I found. Going to bed earlier helps the detox pathways. A longer day. So you know how people usually feel better in the summer when there's more sun and the longer days? Longer days, more sunlight actually helps the detox pathways. The dehydrogenase system, as I call it. There are certain foods that help the detox pathways to run faster. There's very few of those actually. There's a lot of foods that slow it down. Excess sugar, especially liquid sugar that you drink, will tend to slow the pathways down. Whether it's real sugar whether it's fruit juice or whether it's soda, the sugar tends to slow it down. Certain vitamins slow it down. We have a lot of things that slow it down and not many things that speed it up. There's a couple of herbs and other foods. These are on the food list in the detox program. This is what I spend my time doing and assembling. So I can't just rattle off foods here, but generally avoiding medications is really a helpful thing to do. But there are certain medications that we know break the system. Like for a lot of you women in here, birth control pills totally screw up your detox system. It is known that birth control pills by themselves can cause vitamin A toxicity. Birth control pills make women more sensitive to alcohol. Do you remember what I talked about with alcohol in the detox system and how that relates to vitamin A? So birth control pills slow down your dehydrogenase system, the alcohol dehydrogenase and the aldehyde dehydrogenase, which makes women more sensitive to alcohol, which is why they warn women who are on the pill, don't drink too much alcohol, you're going to get more drunk than you used to. The other thing that they tell people on birth control pills is don't get too much sun, because too much sun will burn you a lot worse than it used to. Your eyes will be more sensitive to the sun, your skin will be more sensitive to the sun. Doesn't that happen with Accutane too? Don't they tell you not to get too much sun in your eyes or on your skin? Wear lots of sunscreen. Photosensitivity, light sensitivity happens when you have too much vitamin A in your system. That's what happens. I have people now who used to, including myself, who used to get burned all the time from the sun. And now they've been doing the vitamin A detox for however many months or a year, and they say, what? I don't get burned anymore. This is crazy. I don't have to wear sunglasses all the time anymore. It's because they're not poisoned anymore. So there's lots of things that we can do to avoid, to not slow down the detox system. Like, I think I mentioned earlier, coffee. Coffee slows down the detox system. Everybody's drinking coffee in the morning. So they might be tired because they're vitamin A toxic, but if they take coffee, that's why they get stuck on coffee. Is because they're just getting more and more toxic all along the way, and their energy is getting worse and worse and worse. So they feel like they have to have coffee, but the coffee is making it worse and worse and worse until they quit the coffee. So, Leah, if she were to ditch Accutane, could you help with detox in her acne? As the Accutane would not have cleared it after just 4 weeks use, and yes, she knows everything. It's going, the thing about it is fixing problems. I mean, there's a reason why people take medications, is generally they want a simple and quick solution. And whether they realize it or not, they think they're willing to deal with the fallout, with the side effects. Most of the time, when the side effects are bad, like what this group exists for, they didn't want the side effects and they don't like the side effects. So it's going to take longer, but she will end up healthier. So yeah, you can do the right things and end up healthier, or you can do the quick and easy and dirty things and potentially end up with side effects for the rest of your life, unless I was there to fix them after you get them. But still, a new car, a used car will never be a new car again. So taking medications and having them damage your health, I'm not going to claim that I can make somebody back to 100% again. Hopefully we can get them back to 90%, maybe 95. But I don't know that we're ever going to get them back to 100, because, you know, it's like a used car. It's never going to be a new car again. That's life. Aging is a bitch, right? So, Angela, yes. Angela says, thank you, very interesting. Obviously, that's very opposite to what the root cause person says regarding ceruloplasmin. It's tricky to navigate it all. Let me tell you the difference between me and other people out there. I am only after the truth. I'm not after protecting my reputation by sticking to something I said once, even though I realize it's wrong. I want you all to know here, I was one of the earliest people out there saying don't take vitamin D supplements. And if you're taking vitamin D supplements in here, don't. Probably make your acne worse. Don't ever take vitamin D by mouth. Cod liver oil, vitamin D supplements, no. There's a great website. If you live somewhere where you don't get any sun and you want to get some sun, then go to a website called thetanningguru.com. I'm typing it on here. Thetanningguru.com. He is the guy where you can find out how to make vitamin D from light, tanning beds, UVB, spurty lamps. There's reptile lamps that make UVB. You can do it, you know. So get some sun, get some UVB. He even talks about putting lotion on your skin before you do any type of tanning, because it helps you to make more vitamin D. He's got tricks like that. He is super smart. don't take vitamin D supplements. That will make your acne worse. So I used to tell people to take vitamin D supplements. I was one of the early ones. Then I was one of the early ones to stop telling people to take vitamin D and tell them to stop taking that rat poison, TerraD3, TERAD3, the number 3, Terad, TERAD3. Look it up, rat poison, blocks of vitamin D for rat poison. They use the vitamin D3 as rat poison when the warfarin, Coumadin rat poison doesn't work anymore. So it's a step up from warfarin, Coumadin, blood thinner. You give that to the rats that don't die the first time. So don't take vitamin D supplements. But anyway, at one point I had to change, and I realized that I had been led astray by the vitamin D supplement research and pundits on the internet, and I had to completely change and say, don't take vitamin D anymore. That was a big mistake. Sorry, but now we know. And ever since then, I've been a huge advocate of don't take vitamin D supplements. Don't. I gave people vitamin A in my practice based on what I was taught in hair analysis. I gave people vitamin A. It took me several years to figure out that there was a problem because vitamin A toxicity with supplements or food is very slow. It comes on very slowly. So it's really hard to figure out. At some point I read, oh, here, you guys can go read, ggeneru.blog. Grant Generu is the guy who introduced me through his free ebooks. So if you go to his website, you can read his free ebooks. There's not a lot of stuff on treatment in there. I mean, he's just like, eat beef and rice and beans. Don't eat the cauliflower. Don't do that. Leave the cauliflower out, full of formaldehyde. Cauliflower is full of formaldehyde. Don't eat it. Pick other vegetables. There's not that many vegetables that are okay on my program. Vegetables are kind of, nature doesn't want you to eat them. They put a lot of chemical warfare in there. So, but there are ones that are good. Asparagus is a good vegetable. I'll put it that way. Asparagus is a really good one. And if you can find parts of vegetables that are white that you eat other than cauliflower. So if you're eating a part of a vegetable that's white, you're pretty good on vitamin A. White is not a vitamin A color, generally. So where was I? Oh, the ceruloplasmin plant. Well, so I got to the point where I realized vitamin A was a poison after reading Grant's work. And what I do is I take people's good ideas and I then figure out how to make them work better. That's what I do. I'm never the original idea guy. I don't come up with the original ideas. Somebody else tells me about it. Somebody else told me about vitamin D supplements being bad, and I ran with it. And I started posting tons of research on my Facebook about how vitamin D is a poison and you should avoid it, and it causes all sorts of problems. And then I found Grant. Grant introduced me to vitamin A toxicity. I took it, I ran with it, and now I'm kind of the expert in vitamin A toxicity and how to get rid of it. So I had to eat crow a bit, say, yeah, I know I used to tell you to take vitamin A. I'm sorry, I made a mistake. I know better now, so I'm going to do better. Some people who have started advocating cod liver oil and all these other natural vitamin A don't believe that vitamin A, here, let me put, for those of you who want to think that natural vitamin A is okay, let me show you, Angela, you might like this. Let me show you all the research on cod liver oil that shows it's a poison. What does cod liver oil have in it? Well, fish oil, which I don't recommend, vitamin A, and vitamin D. Huh, that's like trifecta of bad for me. And I know the stuff you're going to hear me say is totally the opposite of everything you hear everybody else say, and you think, is everybody else out there sick? Pretty much. If you're really being honest and you look around, pretty much everybody is unwell in just about some way out there. This is not normal. This is not the way it should be. So maybe everybody's doing things wrong. So David says, so glad you're doing this for us Accutane victims. You are welcome. And thanks to Angela for giving me a heads up to come on into this group and speak to you guys. Let me just make sure. I don't think there's any more questions, and I think I've done quite a bit today. If anybody has any questions right at the last minute, this is the last chance to get them in. But yes, so I'll go over the things that I talked about earlier. So on the comments, the text that I put above, there's the places where you can read the free material. I put out a lot of material. There's my blog forum, which is on my website, which is where a lot of the articles that I wrote link to. So those are coming straight from my website. If you see Nutrition Restored /blog-forum, that's from my website. I wrote that. If you go on my Facebook page, you're welcome to go and friend me. My personal page is mostly business posts, like about vitamin A and this kind of stuff. So if you want to go friend me on Facebook or just follow me, that's fine. You can search my timeline. If you look up how to search someone's Facebook timeline on Google, you can find out how to search it. You can search for all sorts of things. Iron, copper, calcium, vitamin D, vitamin A, all that stuff. Then there's, what else do we have on here? I have a YouTube page, Nutrition Restored, youtube.com/Nutrition Restored. I have a lot of videos there. People seem to like those. My Mighty Network. Okay. I have a Mighty Network. A Mighty Network is like a miniature social network. It's like a miniature Facebook. It's like my little miniature Facebook for talking about vitamin A toxicity, for talking about whatever I want to talk about. You guys can see I have a couple things to say. So you can join the network, the outer part, for free. And I do put information in there that's useful. And then you can, if you want to purchase any of the courses or other things, those are available in there. The detox program is in there under courses if you want to get it. Then, yeah, the detox program, like I said, I have a link there to it. It's inside the Mighty Network. It's inside the Nutrition Restored, nutrition-restored.mn.co website. That the link takes you there. Nutritional restoration, we talked about. That's where I'm fixing people's essential minerals, nutrients, vitamins, based on testing, not guessing. So we're doing blood tests, we're doing hair tests. Like I said, I take international clients for any of this stuff. I just can't run blood tests on people outside of the US. The homeopathic detox therapy. For those of you who are in this Accutane group, like I said, if you are seriously just like, Accutane, I've never been well since I took Accutane. You can do whatever the Accutane broke in your system. I don't know if avoiding vitamin A in your diet and doing other things will ever totally fix what the Accutane broke. I don't know that. I'm not going to lie. I'm after truth here. So I'm not going to say that I know that we can undo the Accutane damage with just diet and maybe some herbs and some minerals. I don't know. Still waiting to figure that out. Haven't had enough time yet with people doing this. I mean, we're a year into it, but we're still, the homeopathic detox therapy was something I introduced months ago. It's been going quite well. We just don't know. I don't know which, if we require, because here's the question. If medications can damage you and reset things like the detox pathways lower, can homeopathy, we know homeopathy can undo that. Can diet and herbs and supplements and stuff like that fix it too? That's what I'm not totally sure of. We've been getting better results since we have people adding on the detox therapy to the other stuff. That's what I can say. So what I can say is the nutritional restoration and the homeopathic detox therapy by themselves, I mean, together, do more than the two things separately, right? And then there's I have the page on there, drgarrettsmith.com. That's a page I'm associated with where there are supplements available that I use with the detox program. It's not all the supplements I recommend by far. It's just ones that we have available. So if you want to go check that out, we got C60 there, which grabs onto vitamin A, helps get it out of your liver. We got turmeric and curcumin together. We got coconut activated charcoal. We got a bunch of stuff there. So think that's about it. So again, I'm Dr. Garrett Smith of nutritionrestored.com. People call me the nutrition detective because I figure these things out. I hope you all enjoyed this. I hope you got something out of it. And I hope to help you guys in the future, whether it's from today's or whether we work together doing other things. Have a great day.